So when prepping an upper extremity, you want to take into consideration where the incision site is. And as long as you follow the principles of incision site going out towards the periphery and doing clean to dirty, there's multiple ways to do these preps. Also, whether you have someone holding the extremity or whether you have to hold it yourself depends on how you're going to go about the prep. So say on this patient that we were doing a carpal tunnel ulnar nerve case. So we have our one incision roughly on the elbow, on the back side of the elbow, and then we also have the wrist area. First, we want to make sure to put our drip towels underneath our patient to catch any excess prep. We want to open our prep, we want to don our sterile gloves, and then we're going to begin. We're going to take our Chloraprep and do our pop and stop and let the solution start to come to the top of the sponge. When that happens, what we're going to do, you can do this a couple of different ways. If I had no one to help me hold the arm, then what I would do is I could start at the carpal tunnel and do my 30 seconds. We're scrubbing back and forth because we want to drive it into the layers of the skin, and then we would be able to go circumferentially as much as possible without touching the bed all the way up to the arm, making sure that we are avoiding the axillary area. So if we did it that way, we would go all the way up the arm, then we could come down and do the palm of the hand in between the fingers and go all the way around the thumb. At that point, I could take my sterile hand, other hand, lift up the arm and get the back of the hand, throw this Chloraprep away and get a new one, and now I could raise the hand that I've already prepped, take my new prep stick, start from underneath and do my 30 seconds on my ulnar nerve site, go up to the arm, catch the axillary area, throw this one away, grab a new one, and come down the forearm. So there's multiple ways to do it. It's always remembering that you're going to start at your incision site and you're going to work towards the periphery from clean area to dirty area. If I'm lucky enough to have an arm holder when I do this prep, then they would be holding the hand when I got started, and I would be able to, assuming this was someone else holding the arm, I could start at the ulnar nerve and I could work my way circumferentially all the way around the arm to the shoulder, making sure not to touch the axillary area. And then I could come down the arm. I would prefer to get a new one. So at this point, I probably would get a new one, come down from the ulnar nerve prep, do my 30 seconds over my carpal tunnel site, catch my arm, now do the hand and the back of the hand, and then do my axillary area last and throw this one. So there's no way that you can do an extremity prep, an upper extremity prep, without using at least a minimum of 2 Chloraprep. And as we've talked about before, better a $4 Chloraprep than a $40,000 infection. So please use however much prep you need. Also remember, these only do a 12-inch by 12-inch area. So even though it's painting the area orange, it's not laying down the proper amount of chemical. So always make sure that you get enough Chloraprep to cover the area that you have and figure out basically what would be a 12 by 12 area. So make sure you use sufficient prep. After that, of course, we're going to make sure that it does our 3-minute dry time before we drape out.